Entered its third day today as services continue to be paralyzed in many hospitals. This even as the Salaries and Remuneration Commission says there exists a collective bargaining agreement between the government and the Kenya Medical Practitioners and Dentist Union, KMPDU, which spells out allowances to health workers. Zainab Mohammed reports.
The Salaries and Remunerations Commission, SRC, says it can't enter into another collective bargaining agreement since there already exists a CBA signed in 2015 and reviewed in 2017. The existence of 2015-2017 CBA provides for doctors' call and risk allowances, a CBA that prevents the salaries body from altering the payment amounts until its expiry. This is as the Kenya National Union of Nurses, KNUN, announces a total of 28 nurses who have contracted COVID-19 since the start of the pandemic. According to the union, some nurses are going to work despite the nationwide nurses' strike that kicked off 3 days ago.
If you are a leader in this union and you sabotage this cause, we will suspend you, we will excommunicate you from the union leadership. You will never go close to this union for the rest of your life. We will not allow nonsense. If you are a union official and you are on the ground and you are being coerced, you are not going on strike. We are telling you, your days are numbered.
The union further says some counties are using blackmail and coercion to force nurses to work, something they will not be party to, as the strike will go on until all their demands are met.
I have directed any directive from any arm of government, and I'm very serious. We have 3 arms of government: the judiciary, the executive, and the legislative. None of these 3 arms of government shall issue any directive for any nurse to go back to work. I want to tell those who are running into courts and obtaining court orders that those court orders are being issued against Occupational Safety and Health Act, Section 14. We will not go back to work where working environment poses highest health risk to our members.
Meanwhile, the Kenya Conference of Catholic Bishops are pleading with the government to come up with a quick solution towards the health workers' strike, as the strike is crippling many public hospitals while rendering patients helpless.
The legislatures is treated with love, care and protection. Salaries and the accompanying packages for the lawmakers are always handsome. But doctors, the cry of these doctors, nurses, and support staff, some of whom stand on the front line, as is the case with the fight against COVID-19, is hardly listened to. This is the dilemma the government needs to address.
Zainab Mohammed, TV 47.